Now, sometimes the simplest things in life are the things we take for granted. You know, like when neck and back pain hit, man, I tell you what, there's just something that puts the brakes on everything.
That's right. And when an avid runner could no longer do active things with his grandchildren, he knew he needed to get help. So he turned to Dr. Miller, Total Health Chiropractor. But we cannot stress it enough. Do not let neck or back pain ruin your quality of life. And someone who has helped so many people get that quality of life back is Dr. Miller here at Total Health Chiropractic. Hi, Doc. How are you?
And welcome to our office.
Thank you so much. And Bill, thanks so much for joining us today. We'll get to your story in just a minute because I know this is something that's really affected you. So about that sciatica and that neck and back pain really affects so many people.
It does. And, you know, like you said, a lot of people don't just have neck or back pain, but when it gets bad enough, it can start affecting the extremities. And so a lot of people do struggle with a condition called sciatica, which is the largest nerve in our body, and it runs down our leg. And so it can be a very painful condition, not just back pain, but can go into the buttock or the hip, down the leg, and, you know, not just be painful, but it can affect your ability to function and do the daily activities that you want to do. Even though it's pain in the leg, this condition comes from problems in the lower back because that's where these nerves start from, and then they form the sciatic nerve down the leg. So sometimes people are confused. Even though they have leg pain, it's not an actual problem in the leg, it's stemming from the lower back.
How does this come about? Can people wake up one day and just realize and have this pain, or is it something that kind of gradually shows up?
It can be either. It can be after trauma or an accident, but I think for most patients, it's almost like when you have a toothache or a pain in your tooth, where you notice it one morning, but it didn't actually start that morning. It had been building up over days or weeks or months. It's just a lot of times we're able to adapt to these problems or compensate for them. And then as the condition progressively worsens, like you see on these models here, a lot of patients reach a point that it's just so far gone, then they can't adapt to it anymore, and they start feeling those symptoms of pain.
That's right. And so you want to try to get to these people before they go through the treatments of what, injections and surgery. How do people typically treat something like this?
Well, a lot of them go through the medical route, which is going to be usually starting with drugs and physical therapy. It's interesting. Sometimes they don't even have a diagnosis. They just know they have back or leg pain, send to therapy for that, but they don't really know what the cause of it is. As those things don't work, then they start getting to higher levels of treatments, which can be higher levels of drugs or injections at the pain clinic, which is just temporarily reducing inflammation in that area to give temporary relief. The worst case scenario would be neck or back surgery, but most of these treatments revolve around symptom relief. They're not fixing the cause of that pain, and that's why they got to keep taking the pills every few hours, go back to the pain clinic every couple weeks or months. It's just they don't see an end in sight because they're now working on fixing it. They're just temporarily masking the pain.
How are you able to help them without the injections?
Well, Leanne, we do non-invasive solutions here at Total Health Chiropractic, and so our goal is not just to mask the pain temporarily. We're focused on correcting the cause of that pain so our patients can get long-term relief and, you know, get more of a normal life back once again. One of the best treatments that we offer for these chronic conditions is called true non-surgical spinal decompression. We use a machine called the DRX 9000C, and it's a medical device that's used to heal and repair and regenerate these problems in the spine. So we actually work on regenerating the discs, fixing the problem. It's great because it's a non-invasive treatment. There's no drug shots or surgery involved. There's really no downtime. Patients are able to continue driving and living their life as they go through this. But it's just awesome to see, you know, when they get that quality of life back, just the happiness on their face because they know they've done something to really fix it. They're not going to have to just keep taking pills or shots the rest of their life.
Yeah. And you're sitting next to Bill. So were you able to help Bill? I assume that's why he's here today with us, right? I see a smile on his face underneath his mask.
Absolutely.
Yeah. So what is it that you were able to do for Bill?
So with Bill, we did the spinal decompression. These are programs combined with other treatments, so it's very important you do the correct treatment at the right time. But you know, he had a lot of degeneration in his lower back that was causing his back and leg pain, and you know, we worked hard and he worked hard on his part, did everything that we asked of him, and you know, it really turned around for him. And you know, he can speak for himself, but you know, he's able to live much more of a normal life once again. I don't want to jump in too much with what he's going to say, but I mean, he had used a cane often, and now he's able to do a lot of things without the cane. So we're happy to help Bill.
So Bill, thank you so much for joining us here today. Let's go ahead and talk about your condition before you came to see Dr. Miller. What were you experiencing?
Well, I used to be a long distance runner, and I used to love to run, but it got to a period of time when I couldn't do it anymore. And it got to the point where it was a sciatica problem, and a surgeon who I've seen for a couple different times said, now's the time for you to have surgery, but before you do that, try any other way you possibly can, because you're over 70, and it's very dangerous that period of time. Fortunately, I found a doctor, and I can't tell you how much better I feel, because I used to walk around with a cane, and I don't walk with a cane anymore, and I don't take pharmaceutical medicines anymore. I mean, anybody would want to have that. Absolutely. And I can only tell you how grateful I am to the doctor to present this to me so that I could take advantage of it.
So you were basically a pain level of 9 or 10, had a cane, and coming to the DRX program, I actually understand it actually feels kind of good getting stretched out like that.
Oh, it's relaxing, and forget about any pain. It's relaxing, and you could almost fall asleep in this area, and it's amazing. He presents you with ways to get better on your own too. You help yourself. You do exercises on your own that they prescribe for you, along with this program. And so you help yourself, and they help you. It's a tremendous program.
So talk about those things you can do now that maybe you took for granted before.
Well, it's just the fact that I can run around by the pool and be by the pool with them. And I plan on going skiing with them this winter down to Boyne Mountain, and these are things I plan on doing. And it's all very enjoyable to me to be able to do these things with my grandchildren.
You hear so many people that have stories like you, and they'll live that way for years, but this is your chance to kind of reach out to them and say, stop living like that.
Why don't you want to? I mean, please listen to this man. That's all I have to say. And that's basically it. Being pain-free, why not? I'm over 70. I don't want to be in pain for the rest of my life. And that's just the way it is.
Sounds like the granddaughters need to keep up with you now.
Well, they'll try.
Thanks so much for sharing your story, Bill. Well, let's talk about that new patient special we have for our Fox 17 Morning Mix viewers.
Leanne, we don't want your viewers to struggle, so I am going to be offering a $60 special. They can call our office, and for $60 we'll do a consultation, an examination, and also take us 2 x-rays so we can actually diagnose their condition correctly and start showing them, so they can see with their own eyes what the problem is, and then I'll start working on developing a solution for them so they can feel as good as Bill does and start enjoying life once again.
Absolutely. Don't live in pain any longer. Get that quality of life back. Come see Dr. Miller at Total Health Chiropractic.